Hello, I am Dr. Girish Nelivigi, Urologist and Andrologist from Nelivigi Urology and Multi-Speciality Hospital in Bellandur, Bangalore. Today, I will be discussing on a common and a very important urology problem, and this is called Vesicoureteric Reflux. This is a disorder in which the urine, instead of coming from the kidney, ureter, bladder outside, it instead goes back from the urinary bladder into the ureter and into the kidney, which means to say, instead of coming in an antegrade fashion, the urine flows back in a reverse direction. This is a congenital disorder, which means to say it is present since birth. It is usually detected in newborns or in children, and it is seen in 1 in about 500 babies. What is the cause of this disorder? Normally there is a valve which is one directional, which does not allow the urine to flow back from the urinary bladder into the ureter. However, in some babies this valve is not present and the urine goes back into the kidney. Now, what are the problems that this problem causes? One is the baby may have urinary tract infections. Second, over a period of time, as the baby grows up or even in adulthood, the kidney may get damaged because of the backflow of urine into the kidney. These are the reasons why this disorder has to be detected and treated. There are many investigations to detect this disorder. One is ultrasound, second is a urine examination, third is a test called MCU or micturating cystourethrogram, and also a radionuclide scan to see for scarring and damage to the kidneys. What are the treatment modalities in this problem? In low-grade reflux or in mild reflux, usually we do not treat this. If there is infection, we give antibiotics to the baby, and sometimes we give long-term antibiotics if the infection is repeated. However, if the vesicoureteric reflux is of high grade or is severe and is causing damage to the kidneys or scarring in the kidneys, then that has to be treated by surgery. This surgery is called ureteric reimplantation, and there are many ways of doing this surgery. It can be done by keyhole technique or by open technique, in which a small cut is made in the lower part of the abdomen and a valve is created so that the urine does not go back into the kidney. The surgery takes about 2 hours. The hospital stay is about 1 day, and the child can go home the next day with the urine tube or a Foley's catheter. This tube will be there for 5 days, after which it will be removed. Therefore, to conclude, in case your child has vesicoureteric reflux, it needs to be evaluated and treated, and the results are quite good with a high chance of success. Thank you.